Getting a good latch doesn't seem like it should be difficult, but it is one of the most challenging things that a new mom might encounter. In this video, I'm going to share some tips and tricks for helping your baby get a wider mouth so you can get a more successful latch. Before we get started though, be sure to grab my pain-free latching guide and checklist, which you can grab in the description below. It has some great tips for getting you a better latch and making it a little more pain-free. So why does a wide mouth matter? When you're breastfeeding, you want your baby to have as much of their mouth on the breast as possible. We don't want your baby just hanging onto the nipple, which with a more narrow mouth is going to happen. When your baby's mouth is more open, they are able to use more of their jaw and get a more effective feeding session in. So it all starts with having that mouth wide enough. We really want the mouth to be at a 140-degree angle or wider. And we want that upper lip to be flanged out or at least neutral, and that bottom lip needs to be flanged out as well. I often find that bottom lip is the culprit for many breastfeeding issues. It's also important to remember that we're not trying to play bullseye with your baby's mouth with your nipple. The nipple needs to be towards the roof of your baby's mouth to get the most effective latch possible. Having a wide open mouth is going to prevent pain and damage and help your baby to transfer milk more effectively. Think of it like having a big sandwich in front of you. If you just put your mouth out like this and you take a tiny bite, you're not going to get a good grip on that sandwich and you're not going to get much to eat. However, if you have a wide mouth, you're going to get a better grip and get more food. I don't know if that's a great analogy, but that's what we're going to go with. I've already mentioned a little bit about what to look for in a good latch, but I'm going to mention it again because it's so important. We want your baby to have their head tilted back and to have lots of space between their chin and their chest. We also want your baby to have good alignment. I see a lot of moms breastfeeding with their baby like this and the baby's body out like this, and that is not going to be effective. I'd also challenge you to try taking a sip of water with your chin touching your chest. Also try to open your mouth wide and see how hard that is. So making sure your baby is able to get good neck extension can make a huge difference. For most moms, I find that bringing your baby further down on the body also helps. This makes it so the baby has to reach their neck backwards and that they're not just going straight onto the nipple. If your baby is so close to the nipple that as soon as they get there, their upper lip is stimulated, which causes them to start trying to nurse before they are even on the breast. When they're further down like this, or even doing the koala position where they are going to be like this, and they have to tilt their head back and they're not straight on with the nipple, they are going to get a wider mouth and have more of an opportunity to get a wide mouth. Some holds are better than others. As I've already mentioned, I really like to have your baby be diagonal on your body. We don't want them to be straight like this. That's where nursing pillows can really throw you off. Have your baby be at a nice angle, have their feet grounded against a chair or a pillow or anything like that, and have them further down on the breast than you think. We want a good asymmetrical latch and not the baby coming straight on. The koala position is also awesome. That's where you have your baby's legs straddled. You can have them on this leg or on the opposite leg like this. And this does allow your baby to get a much better latch than, say, in the football position or if you have them straight like this. Sometimes you'll hear the term nose to nipple, but instead I want you to focus on chin to breast. When you get your baby's chin about an inch or so below your nipple, going this way, have your baby's chin hit the breast right here with their chin first. There's a reflex in the chin that causes your baby's mouth to open, and that's going to make it easier to latch. So when we do nose to nipple, sometimes that's going to stimulate your baby's sucking reflex and cause them to clamp down sooner than they need to in order to get a good latch. Don't rush things as much as possible. I know some babies are more aggressive than others, but I find if you take some deep breaths beforehand, maybe do some skin to skin, and really focus on helping your baby to get their mouth open before bringing them onto the breast, it can make a big difference. If you find that your baby just goes on the second they see the nipple, you can try and do the flipple. This is where you pull your breast back like this and get that nipple out of the way. So you'll flip your breast and your nipple back, put your baby's chin into your chest, wait for them to tilt their head back, get a wide open mouth, and then pull them onto the nipple. I've seen this be a really effective tool for many moms. If you're finding that your baby is not opening wide no matter what, go back to the basics. Take deep breaths, do some skin to skin, put on some white noise or some relaxing music. Your baby might just be a little bit stressed out, And sometimes even just giving them a pacifier to do a reset can also help as well. However, if no matter what you do, you feel like your baby just cannot get and sustain a wide latch, that might be a sign that you should work with a lactation consultant. There are some exercises that I like to recommend for babies that have a harder time opening their mouth. And one of those is just doing a TMJ massage. So that's where you go right outside their jaw and you just gently massage. And this can be really helpful for relieving any tension that might be in there. Other ones you can try is taking your second knuckle and pressing gently into the bottom of your baby's chin for 3 seconds until they open their mouth. Just repeat this 5 or 10 times. And finally, one of my other favorites is where you take your finger and you put it sideways back where your baby's molars are going to be, and they generally should start to chew. You want to get about 10 chews on each side. This just helps to strengthen those muscles and help them to open their mouth more wide. Sometimes it can be because of tension or a tongue tie or any other number of reasons that your baby isn't opening their mouth. So again, this video is just the basics, and you should work with a lactation consultant to make sure that you have the best resources possible for your baby. And yes, I do virtual lactation consults worldwide, and I do them in my office here in Denver if you happen to be local. I would also encourage you to try not to wait until your baby is starving to get them to latch. They are going to be a lot less patient and a lot more aggressive at trying to get on the breast, and will probably get more frustrated if they aren't getting milk as fast as they want. So try to feed more frequently than not. Remember that breastfeeding has a learning curve for everyone, and if you're struggling, it is not a sign of weakness to reach out. I love when moms reach out to get help. We are here to support you in whatever way we can. It's amazing what small differences can make. I was just in a lactation consult where a mom told me that she couldn't believe how some of the things I told her were so simple, but they made the hugest difference. So don't be afraid to experiment and see what your baby responds to and what works with your anatomy the best. I would love to see you in my class, Fuss-Free Latching. I have tons of resources about how to latch your baby, navigate common issues, and even a bunch of different exercises you can try to get your baby to latch more effectively. It's super affordable, and you can sign up in the description below. Either way, I hope this video was helpful in getting your baby to get a wider latch. If you have any questions, drop them below, or feel free to reach out if you need a lactation consult. Hit the subscribe button, and we'll see you next time.